Hello, everybody. Welcome back to Talking with Heroes. I am Bob Calvert, the founder and host of this program here in San Antonio, Texas, June 2018. We're here at the Stephen A. Cohen Military Family Clinic at Endeavors. And it's an honor for me with TalkingWithHeroes.com and thank you for your service.us to be able to be here. And we're here talking right now with another veteran, 6 years in the Navy, Jill Palmer, and she is the clinical director of the clinic. So first of all, thank you for your service. I appreciate that you're still serving. I love watching this because I've seen this for years. People get out of the military, they're doing something else to help their fellow veterans. Mm-hmm. So thank you for that. So tell us a little bit about yourself. Start out with your Navy career.
Sure. Well, thanks for being here. So my name is Jill, and I joined the Navy a little later in life. I was in my mid-30s. I've been a social worker for about 20 years, and I went to go work as a social worker in a Navy program in Jacksonville, Florida. And I had the opportunity to just see how social workers are ingrained now in the military presence and being able to provide support to our sailors. And so I had the opportunity to join the Navy, and I walked that path for 6 years. Got to stay in beautiful Sasebo, Japan for 3 years, which was wonderful. And then was in at a hospital in Washington State. Both of those places I worked in either mental health or the children's services, and was really able to provide services as a uniformed social worker to our men and women, keeping us safe, keeping freedom, keeping shipping lanes open, doing the tough work on ships, on shore. And it was just a really immense pleasure. And I'm really happy to be here at the Cohen Clinic.
So what led you here?
So I exited the military and wanted to continue working for our veterans, and this just seemed like a really perfect fit. The leadership skills that I gained from joining the military was the most amazing part of my social work career thus far. So I wanted to continue to use my leadership skills with my clinical skills and being able to provide care to veterans and their families. And so this clinic was exactly what I was looking for.
So talk about a little bit about what you do here, but also a little further in the program, all the different cities that you're in.
Yeah, so here as the clinic director, my role is to manage and help support our amazing providers. So we have social workers and psychologists and a psychiatrist. We have med management. We also provide support services. We have clinical case management. We have social work case management. So we're able to really wrap our arms around the family or the veteran or their children and be able to get them services that they need. Transition services are not always diagnosable in regards to mental health care, but it is a place where we see families needing support. Leaving the structure of the military setting is a change, and it's one that can start a domino effect. And we really want to make sure at the Military Family Clinic at Endeavors that we are providing care right at that beginning point. So our intake process is simple over the phone. It's just a phone call. Today I got to watch 2 walk-ins come in saying that one of them said they heard a commercial and they needed some care. So we provide urgent care when it's needed. We also provide short-term evidence-based treatment. So what that means is we provide clinical services that have been researched and show that you get better. And that is our focus, is making sure that our clients who do need mental health care and need a therapist, a licensed provider, that they are getting better. And we know that because at all of our clinics across the country, which there are 10 now, we utilize a quality of life survey, which tells us, is that client satisfied with their life? And those scores increase. The other thing that's really wonderful, we pay attention to what our clients say to each other. And they tell us in our exit surveys that they would support our services and refer our services to 97% of people. So 97% of people say, yes, I would tell my brother, my sister, my fellow veteran to come here to this program. And that is is wonderful because that's what we want. We want people to tell us how we're doing, and at the moment we're doing what we want to do. The other piece that we do is we help with no barriers to care. We really want to make sure that we're able to continue our mission, but that we are also able to provide care. So lots of times some things will get in the way, whether that's distance to the clinic. So the Stephen A. Cohen Military Family Clinics that are in Texas, which there are 4. There's one in Dallas, there's one in El Paso, ours here in San Antonio, and there's one in Killeen. We now partner together and provide telehealth services. That is an amazing opportunity for behavioral health care. You can be anywhere across the state of Texas, and we will provide mental health care for you anywhere from 8 to 12 sessions. We can also then provide follow-on care by supporting more telehealth services across the state, or we can provide some case management via the phone and connect you with other resources. So that's an amazing opportunity. We also have services across the country. We have a clinic in Fayetteville, North Carolina, that is partnered with Cape Fear Valley Health. There's also a clinic in Pennsylvania that's partnered with a university. There's also 2 other universities. NYU has a clinic, and then there's a new clinic in Denver that's also partnered with a university. So one of the pieces about our clinics is that we go and we partner with the local community. So I am an Endeavors employee here in San Antonio working with my clinic with the community. There's also going to be clinics in Tacoma, Washington, San Diego, Virginia Beach, Virginia, and Tampa, Florida.
It's okay, you did better with that. Memory just drops out of my brain at 71, so so that is really fascinating. So I guess before I even close, I'm going to say this to people watching. You probably know somebody in one of these cities. And when I first pulled it up on the website, I saw Denver. Well, I'm in Colorado Springs. My daughter and her husband are veterans. I know so many veterans, and none of them have heard of it. Now they will. And so we need you to help telling people about it too. Okay, so so talk a little bit. Do you have any special stories, testimonies you can share? Maybe not mention last names or something, but...
Sure. So I've had the great pleasure of actually working at 2 of these Cohen clinics. And so here at the Endeavors Clinic, I just got to witness a family walk in, a mom, asking for care for her children and saying, I know someone who used to come here. I just had this experience. My kids are dealing with something. Is this the place I get help? And my front desk staff, so this is an administrative staff member who is the face of our clinic, put that mom at ease. So it's not just our therapeutic services or our case management or our med management services we provide. We provide a well-rounded approach to people in need. We also look at cultural experiences. So we provide education to our staff members about the military culture, about what someone in crisis is struggling with and how to respond to those things. And my front desk administrative person was able to put her at ease, tell her we can help her, and she walked in to an appointment today to get services for her children. And that is really what we're about, is making sure that services are available to the veterans and their families.
So people need to go to, if they want to find out more information, endeavors.org/MFC. And I believe that's on the camera, this beautiful display here. When they go to the website, what's the first thing they should do? I mean, obviously look around, but do they have to sign up or?
No, so our website is pretty easy to navigate. So there is information on our website about some of our life skills classes that we have. So we provide some services that allow for the community to get involved with us, maybe before they want to start mental health services. We are tonight doing a movie in the park, and that is open to all residents here, anyone in the local area that wants to come. So the website is very similar to that. It'll give you our list of programming or availability for some of our life skills classes or community engagement. And then there's a couple links on there. One tells you our phone number if you want to call us. The other one is for some of our intake paperwork. If you want to get a jump on getting some care, you can click on those links, print them out, give us a call, and we'll get you started.
The movies in the park, is that people bring children to?
Yes,
that's good. Being a grandfather, I have to ask that, right? Okay. Well, thank you very much for all you're doing, and I'm continuously amazed over these last 5 years of interviewing 100 organizations that are helping the troops and veterans, and most of these folks leading it, like you, are veterans, like Jeremy, who we just talked to. So vets helping vets. So would you like to give a shout out to our troops?
Absolutely. So hi out there, everybody. Thank you so much for everything you're doing every day. Be safe. And from me and from my family and everyone here at the Stephen A. Cohen Military Family Clinic at Endeavors in San Antonio, be safe, keep your head down, and eat some chocolate. That always helped me out.
That's good. I know a lot of people are laughing about that right now. Okay, and I also want to give a shout out to all of our men and women serving around the world, especially if you're in an area where you could be in harm's way. We want you to be safe, stay alert, get back home here as soon as you can. For everybody watching this, now you've watched this, please share this video. And I believe that probably just about everybody watching this, you've already been thinking about people, family maybe, or people that you know who could really benefit from this, and share the video with them. So I appreciate you doing that. So we'll be back with more from San Antonio, Texas. God bless you all. God bless America.